Hey, so in this video I'd like to share a bit about COVID vaccination in our 5 to 11-year-olds. We haven't really had to think about this too much in Hong Kong because we've been in a bit of a bubble. But now the government is asking for a 70% vaccination rate in our primary school kids before they get to go back to in-school teaching, which we all want. We have the option of 2 different vaccines, just like in adults. So we have the Sinovac at the same as the adult dose, and Sinovac has been given in 2 billion doses on the mainland with very few significant severe side effects and certainly no cases of myocarditis reported. As for the Pfizer-made vaccine in the US, 10 million doses have been given in the 5 to 11-year-old age group, and studies have said that it is a very safe vaccination with very few serious side effects. So we talk about vaccine safety and effectiveness for vaccinations in children. So both of these seem to be very safe vaccines, and with the risk of myocarditis in Hong Kong, the children's dose will be reduced to 1/3 of the adult dose because it's quite a potent vaccine, and it can trigger enough of an antibody and immune response with reducing the risk of severe risk of myocarditis as a side effect. And in Hong Kong, 96 cases of myocarditis have been reported. 34 of those have been in the 12 to 15-year-old age group, with 29 of those 34 being boys. So if you are a boy in the 12 to 15-year-old age group, your risk of getting myocarditis would have been 1 in 3,000. Now, that risk is reduced by 90% if the second dose is delayed by 2 months or more. Hence, for the 5 to 11-year-old age group in Hong Kong, the 1/3 dose will be the second dose will be delayed until 3 months after the first to reduce the severe side effect. Otherwise, both would be considered very safe vaccinations, and side effects would be similar to those seen in adults. Now, some of you may know that the children's dose in Hong Kong is not the pediatric version of the Pfizer vaccine. Rest assured, JCVI, the Independent Vaccine Advisory Group in the UK, has said that they think it's okay to use 1/3 of the adult's dose rather than waiting for the pediatric version or formulation. Then we talk about vaccine effectiveness. Now, for vaccine effectiveness, we know that from the teen study in Hong Kong that 3 doses of Sinovac produces the equivalent amount of neutralizing antibodies as 1 dose of the BioNtech. So said in another way, even 3 doses of Sinovac produces no virus-killing antibodies, and we're really not using it to prevent infection. What vaccination will be used for will be to prevent severe illness. And for those of our children who do get infected, although Omicron generally produces a much milder version of COVID and with fewer severe side effects, if they have a natural infection, either of these vaccines, through the T-cell response, will reduce symptom severity. You know, there will be some protection from the BioNtech, but effectiveness will wane over time. So we're really looking for the T-cell response to give us and our children protection from these vaccinations. I hope this has been helpful to help you make a decision. Take care.